Welcome to the program. My name is Vince Nigro. On Insights, Dr. Carlo Amendolia. He talks about spinal care and your back. I know we've talked about the spinal care issues in the previous shows, but this show we target on certain areas of your back and what you can do to avoid future back pain. Or if you have pain, he'll explain to you what you can do to alleviate the pain. Dr. Amendolia on Insights. Dr. Amendolia, welcome back to the program.
Thanks for having me back, Vince.
Got to have you here every once in a while to catch up on the latest that's happening in spinal care and mobility.
Lots
happening. And I think it's important for us to continue to keep our audience informed on what works, what doesn't work. You hear fads all the time that come and go. I know that we always concentrate on mobility, and the spine obviously is the most important factor of mobility. I mean, if your spine is off, you're off. But over the years, and I suffer from it, different parts, mid-back, as you know, low back, whatever, and your mind plays tricks on you in terms of, is it my spine? Is it something else? But I think it's always important to continue to talk a little bit about the spine, talk about what works and what doesn't work. And I know that a lot of people do different things: medication, spinal taps, injections, acupuncture. There's a lot of different treatments. The suction cups. Everybody tries different things, right? And I know that in the past, a lot of these pain doctors were working on different aspects of treating back pain, and maybe you can shed a little bit of light in terms of what a lot of these pain doctors were doing for back pain and the studies that have just come out and that kind of go against a lot of those things that they were doing. So talk a little bit about that.
Yeah, I'm glad you brought that up. It's because a new study was just published. So these were guidelines published a couple of months ago, and it really shed a lot of light on the kinds of treatments that many patients are getting for spinal pain. And basically, the conclusion was that these particular treatments were really no better than placebo, so the sugar pill. And these are things like epidural injections. These are things like resorption, where they burn the nerves. They're called ablation. Things like blocks, like facet blocks and side joint blocks. These are being done every day in pain clinics by anesthetists, pain specialists, and they're being done all over the world. And this particular study guidelines just published in the British Medical Journal suggest that these particular interventions are really not worth doing, and they're likely causing more harm than good. And this is revolutionary because people are having these procedures done every day at huge expense to governments and to insurance companies, and there is little value on these interventions.
So, doctor, when you say that these doctors are doing this work, would most people who are suffering from back pain get recommended to these pain doctors from their GPs? Because you need a referral to get to this doc.
That's a great point, because the physicians, family doctors are usually not really well equipped to manage patients who have chronic pain. And these are patients who have chronic spinal pain. We're talking about the patients who've had it for over 3 months and sometimes for many, many, many years. And the physicians have tried their medications and tried things like acetaminophen. We know that doesn't work. It's no better than placebo. They'll find anti-benefits. They try things like pregabalin, gabapentin. These are medications that are commonly prescribed for back-related late pain. And we know the evidence doesn't support it. And yet family docs are usually prescribing medications that don't really work for spinal pain. And so when patients come back and say, well, I'm not really no better, then they start thinking, well, maybe I need to refer you to a pain specialist. And they see these pain specialists at these pain clinics, and they're getting all these interventions that had been demonstrated to be no better than sham treatments or fake treatments. And yet patients are going there because they're seeking help, looking for help. And unfortunately, now demonstrates that these particular interventions are not helping.
You keep using the word intervention. It's interesting how that word intervention, an intervention, it's usually categorized when a group of people get together and they're going to do an intervention with someone and help them out. And when I hear the word intervention, you always have a lot of these question marks around intervention. You mentioned spinal tap and a few other things, and a spinal tap. You think about it when a woman's pregnant, you have the spinal tap, and you mentioned burning the nerve endings. Just give us a sense of what we're talking about. If someone went to a pain doctor and they describe, like, how would you do a nerve ending, burn a nerve
So what
ending?
they do primarily is that they have patients, what they're trying to do is trying to offset the messaging from the source of the problem, which they feel is the back, and sending that information to the brain. The brain signals that you have pain. So what they want to do is burn the nerves, or call ablation. And so that signal from the back to the nerve to the brain doesn't go anywhere, because the nerves no longer could send those information to the brain. So those are pain nerves, and those nerves transmit pain to the brain. And so by burning those nerves, okay, the hypothesis is that will try to reduce your pain. So what they do is they first do what they call a blocks, but go to those nerves and they inject an anesthetic, just the same thing you get when you go to your dentist, to sort of numb the area, so they does the dental work so you don't feel it. So they do the same thing. And if the patient says, well, after they do that kind of injection, does it feel better? And if it's 50%, or some people have 60% improvement, then they say, okay, then we're going to burn those nerves, because when we block those nerves, you felt better. So we're going to actually burn those. The problem is, number one, it doesn't work. And number two, those nerves will go back in 3 months. So you have to go back. For those patients that think they got better, and that's usually the placebo effect, patients come back every 3 months, every 6 months, and get these nerves burned over and over again. And now the data suggests that those particular procedures, and they're called interventions, but they're also called an invasive intervention, because you're actually piercing the skin and doing interventions where you're either injecting a drug, or actually burning, or you're injecting an anesthetic. So you're actually intervening, for the point of view is that you're going beyond. It's not something that you're doing physically to the body, but you're going actually invasive, being that you're injecting things into the body, whether they be a cortisone or an anesthetic or a combination of that.
And the reason why I wanted you to talk about it, because at the end of the day, human nature is such that when you're in pain, you'll do a lot of things to get out of pain. And we know there's a lot of people don't have that threshold of pain. So it's important that we let folks know that whether you're doing it or you're maybe thinking of doing it, like, really research it, like, see, based on, like you just said, the studies that have come out that prove long term, it's almost like a waste of money, is what you're saying, that there's
Well, what they've done, just to give you an example, so I want people to understand that you may have these procedures done, and you may think that you felt better. But I'm going to show you an example of what happens when you have these types of injections. There's this placebo effect. And what they've done studies where they've compared people that had the actual anesthetic injection, and then the half the people, they'll get injection with saline. Salage. It's basically salt. Okay, salt water. And they inject these patients. And that the same number of people who felt better in both groups. So if you got the saline solution injection, or you got the anesthetic, you got the same result series. So basically the conclusion is, well, whether you got a saline or a placebo or sham, which is that, or whether you got the actual medication, you got the same effect. So then the conclusion is, those injections in terms of cortisone or anesthetics, it'll actually work. It's really no better than someone injecting sugar or saline into your joints. So that's how they do it. And so, although you may feel better, it's also your mind this is suggested that you're getting really better, but in fact, it's not.
And I don't want to use this comparison. Like right now, the big fats out there are the semaglutide stuff for those Epic or whatever. They say that aside from prolonging their stomach to be full, it works on your mind, what they call it food noise. They talk about how it affects a certain part of your brain that tells you that you have all this food noise. Is it something similar to that, where they kind of work with that piece in your mind? Or that's what they're trying to sell you, but it doesn't really work.
It's really the mind really perceiving a benefit, and then you have to, so we have to go back to understanding the concept of pain. Pain is a personal experience. We all experience pain differently, and so and pain reduction is also very personal to that individual based on their previous experiences, their childhood, how they're brought up, their culture. All that makes a difference of how they experience pain. And so when we have our belief system also plays a role on whether or not something's going to work for us. So if we take, for example, back pain, and we take our patients that have treatment for back pain. For example, we have someone that gets a massage. Okay. And so the massage might have therapeutic benefit, but what's the most benefit is really the connection between the therapist and that particular patient, the trust, the relationship, and the empathy and the compassion that comes from that individual providing that therapy. So it may not be the massage itself that's giving you the benefit, but it's that trust and that relationship and that empathy from the individual provide that. So, but I'm getting back to how the mind is actually providing you with that sense of feeling better, but the benefit wasn't actually the therapy massage that you were getting, but was this kind of contextual factors that came into play.
I'm glad you bring that up because a lot of times when I talk to a doctor or talk to yourself about me or whatever else, and I say to you, could it be this? And you say, no, you rule things out, you rule things in, whether it's a mark or whatever you rule in. And that goes a long way in terms of me. Even if you start to feel, you say, well, it has nothing to do with that, so don't dwell on that. It's more mechanical. Yeah. So that piece really, I have to tell you, for me, and that really does help when you almost get reassured that situation is there.
I'll give you an example. Okay, so when you go see some of these doctors that do injections and all, and they tell you this injection's going to work for you, given my experience, then your belief system kicks in thinking, yeah, the doctor, he's got experience, he's done this all the time, he's telling me this is going to work. And so that in itself will help reduce the pain, irrespective of what you're getting injection-wise. There's been a very famous study in back pain that I often talk about in my lectures, and it was a study where they did an open-label placebo compared to usual care for back pain. I'll explain what that means. So these patients had chronic back pain for many, many years, and they had a randomized control trial. Half of them got the usual care, which means they go see their physical therapist, their chiropractor, they get medications for it. That's the usual care. The other half got a placebo pill, but what's different about this study that the patient was told. So I say, Vince, you're enrolled in the study. Okay, you've been randomized to the placebo arm. That means I'm going to give you a pill that's a sugar pill. Now, we do know that sometimes sugar pills make people feel bad. We don't understand it, but people that get sugar pills actually feel bad. Okay, so we don't know, but we're going to just try this. This is why we're doing this experiment. What did they find at the end of the study? They found that the people that were given the open label sugar pill got better benefit than the people that had usual care. What's interesting is the patients were told they had a placebo, but even though they were told they had a placebo, they still benefit. And what's really interesting, 17% of those people that were in the placebo group asked for a prescription of that sugar pill at the end of the study. That's the power of placebo. And they already knew that it was a placebo. They weren't trying to be tricked, and yet they felt the benefit. That's how powerful the mind is. And how do we explain that? We explain it by the nurse. When the nurse was very comforting, said displaying the placebo pill, they showed compassion, they showed empathy, and the patients got better, even though they knew it was a sugar pill. And this is what was happening with all these interventions that people were getting. They feel that they're getting better, but the actual intervention is not benefiting. They're not giving the benefit of that. They may be getting benefits from the contextual. You're in the big office, you got fancy chairs, you got this light coming on you, all that may impact your belief system. And that's where we believe the benefit is coming from, and not actually the injection or the burning of the nerves. And that's what we want to tell people about.
And just getting back to real pain, your spine and your back, real pain. And we've talked about this in the past. Everybody assumes pain differently, but pain and back pain really is there. And you can play with your mind, and I'm glad we brought all this up. So be very cognizant, very conscious of that. But back pain is still there. And obviously, there are situations, and I just want to touch on, because we mentioned all these procedures, we've never talked about how acupuncture is beneficial or not. Do you find acupuncture, when we talk about needling and whatever, a possible, and not how acupuncture works for everybody. Everybody assumes it differently. Is acupuncture one of the possible treatments you would recommend for back pain?
If we look at back pain, there's been systematic reviews published looking at acupuncture for low back pain, and there has been shown to be benefit. Now, the benefits are not huge. And in fact, in most interventions for back pain, the benefits that we see in these randomized controlled trials are not very large. In fact, no matter what you do, whether it be manipulation, whether you do medications, the benefits are small. But acupuncture, paired to sham acupuncture with fake acupuncture, is beneficial for back pain. So yes, there's some data supporting the use of acupuncture.
And again, just since we're talking about interventions, whatever, anywhere you go in the city, you see acupuncture, and you don't know if they're authorized, not authorized. And there's a lot of people out there that say they do that. If you want to get to a good acupuncturist, what would you recommend? Going through the college? How would you recommend someone if they want to get it?
Absolutely right. There are basically two types of acupuncturists out there. There's the traditional acupuncturists, mostly come from Asia. And these people tend to be trained in Asia, and they don't have credentials, to be acupuncturists. Or be medical. Some of them are medical doctors in their homelands, but they come to Canada and they become certified in acupuncture through different organizations, through naturopathy, through some chiropractors do it, some physical therapists do it. So you could get a credential that way. I think the best way is to go to the college. There's the College of Traditional Acupuncture, and get to see who are on that list. And those are acupuncturists that go through accreditation. And that's the kind of people you want, yeah.
Yeah. Basically, with everything we just talked about to now, it's buyer beware. Just be aware, buyer beware.
I think you have to do it. And then I think there are two types of basic acupuncture. There's the traditional acupuncture, and they use meridians, and they use yin and yang philosophies, and they're trying to balance these meridians, and they're looking at helping with your heart disease and your depression and your variety.
It's a full body type.
Yeah, that's kind of traditional acupuncture. The acupuncture that I've used in the past, and that most clinicians like chiropractors and physical, they use what we call clinical acupuncture, and they're using basically to help control pain, or sometimes numbness or tingling, when things like neuralgia and neuropathic pain, and where there's some evidence for TFJ pain, for example, facial pain, acupuncture can be useful. So that's what we call clinical acupuncture, and there's more evidence to support the particular use of acupuncture as opposed to using it for treating things like heart disease and depression and anxiety. Although there is some data there, I wouldn't say that it's really good, high-quality data.
Just in terms of alternative stuff, a lot of these, and the trend goes up and down, is the suction cup ones, where a lot of the acupuncture people also do the suction cup.
That's more the traditional, and you see a lot of some
you'll see the, even with some basketball players, like I've seen the suction cup where they would get a treatment. Is the theory behind the suction cup similar to the needling, but not needling, and it's more on the suction cup piece?
Yeah. And so again, you're trying to stimulate acupuncture points, and how you do it are different ways. You can put needles in, you can do electrical stimulation, you can use the suction cups. It's basically trying to stimulate these acupuncture points using a variety of different modalities.
Yeah. And just, we can talk about this for a long time. The back pain, obviously, as I said, there is back pain. So if someone's dealing with back pain, thinking of alternative stuff, at the end of the day, it really is come to see a certified practitioner, a chiropractor that can really truly do an assessment for you, and then assess what you may or may not need, whether it's through manipulative procedure, whether it's through exercise, stretching, whatever. Is that the recommendation you would make?
Absolutely. So basically, what we do know about back pain and neck pain is that the best treatment is usually exercise, lifestyle modification, just the posture, keeping fit, keeping active, and trying to avoid passive therapies and passive modalities. That's like medications, like massage. I wouldn't recommend them as the sole treatments. But in terms of exercise, getting fit, and then really trying to also, you know, thinking positive about the back pain. And I think people are really worried about when they get back pain and they go see the MRIs, and then and this might cause further harm because the MRIs will come back with something that likely to do with aging and not significantly correlated to what you've got going on, yet that will give you more anxiety. And there's lots of studies to show that imaging that's done that unnecessarily actually causes more harm than good. So less is more.
It's a good way to put it. It causes you, as you say, if you look hard enough, I'm sure you'll find something.
Especially older people like us, they're going to see something. And so there's lots of good criteria on when to use imaging. I think one of the big thing, Vince, with people that have back pain is fear. They're fearful that they have cancer, or they're fearful they're going to be in a wheelchair. And that fear drives them to seek out all these types of therapies. And many of them don't work. But it's the fear. And so I think it's really important that the practitioner alleviates fear. I've had a number of patients come into the clinic today. And I had a resident, a medical resident with me, training this resident. And basically, it's all about reassuring. It's not a serious problem. You don't need therapy. You just got to keep on doing the things you love to do. And sure, you're going to have some pain, but work through the pain. It's not going to harm you. And that's reassurance that people need primarily.
Just finally, they've said that sitting is the smoking, is of new smoking. And it doesn't matter what age, but even for myself, as I find myself, I sit a little longer, I'll feel like I have back pain, and I have to get up and whatever doing. So a routine of being conscious of not sitting all the time, or if you're sitting a lot, make sure that maybe once an hour, for a couple of minutes, you go up and stretch.
40 minutes, you should be getting up and walking around. Yeah, so people, there's an expert out in the university, in Memorial University of Newfoundland, that's done a lot of work on sitting and back pain. At the end of the day, that for some people, sitting for a prolonged period is not so much the sitting, but it's the lack of activity.
Yeah.
So we think of sitting as sitting, but we're not. But you realize that if you're sitting, you're not exercising. You're not moving. So her conclusion was that it's really the lack of activity that's causing your problem. And that's how we have to look at it. So that's why we said in one of our shows that every 40 minutes, get up and walk around. So not only will you have less back pain, but you'll also be more productive. Your productivity actually increases when you take a little bit of a break after 40 minutes and get back to doing your work. You'll be much more productive than trying to sit there for 3 or 4 hours thinking you're more productive, not taking a break.
So, Dr. A, thanks again for coming by and clarifying a lot of these myths. And, at the end of the day, it's very simple. Buyer beware. If you're thinking of getting into this type of getting this procedure done, ask a lot of questions and at least be an educated patient and whether you want to do it or not. But it's important that we let folks know that, and it's, they talk about science-based. So as you said, a lot of this research that comes out shows it's not working. And so buyer beware. And thank you again for kind of clarifying a lot of that misfallacy about a lot of stuff. And stand up, keep walking, stay mobile,
Keep moving. Motion is lotion.
Motion is lotion. That's a good way to end it. So thanks for being with us.
Pleasure to be there.
Thank you.